Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, so healthcare in Alabama is in more trouble than ever before. Predatory practices are at an all-time high. Patients are losing money if they're lucky. Some are losing their lives. We got big outfits like UAB, University of Alabama at Birmingham, caught stealing the organs from autopsy subjects whose bodies they were entrusted with. Absolutely disgusting. Like something out of a horror movie. Vampires, ghouls. And then a couple weeks later, you see them doing these business deals. $450 million. The big loser is Joe Average out there. Those seeking healthcare locally who are self-pay or don't possess insurance basically get no service in the marketplace now. The corrupt doctors are looking for cushy insurance plans that they can regularly dip into and launch their fishing expeditions. Meanwhile, a situation that needs patient advocacy, customer advocacy, more regulation and oversight than ever. What are our officials and authorities in the state of Alabama using the taxpayers' time and money to pursue? Let's see. Securing profits for legalized cannabis sales. Alabama wants to imitate lawless neighbors such as the state of Florida, known as the home of some of the world's richest and most ruthless drug dealers and gangsters. And this issue touches me personally. There's a couple of key issues that affected my social life personally from my teenage years onward, and this is one of them. I watched friends and family in my life destroyed by street drugs, including marijuana. The spark of life vanish out of people's eyes after they came in contact with this garbage. Top of the headlines, WBRC Fox 6 News television station out of Birmingham reports costly delays. How much has Alabama Cannabis Commission spent while patients wait for products? And it says here the Alabama Cannabis Commission has spent $7.396 million tax dollars since 2022. The state of Alabama passed its medical marijuana law in 2021, and in 3 years they're still trying to formulate the laws and rules of how they're going to sell this to the public. Others out there have questioned the transparency of the procedures, such as this article by the Alabama Political Reporter. And this stuff is just a waste of people's time. There's more important things going on out there, people. I'll replay my call with the Alabama Board of Medical Examiners and Licensure Commission. And this was just before they threw out 11 complaints that I filed against doctors who misdiagnosed a broken skull injury that I almost died from. And several years later, I'm still pursuing this. This is an unresolved, outstanding issue.
No, you've complained on 11 different physicians.
Yes, sir.
Typically, and I want you to listen to me for just a minute, and I want you to tell me
Yes, sir.
your side of it. So you've complained on 11, I believe it's 11 different physicians, and it's basically about each and every one of them's lack of treatment or missing whatever is on the x-ray or MRI, whatever.
Yes, sir.
And you also you're talking about a break at the base of your skull, I believe.
Yes, sir.
You talk about these worms in your skull and neck.
Yes, sir.
Have you had any medical professional that has looked at those x-rays or MRIs and said, yes, those are there, all of these other physicians have missed that? Or is this what you see when you look at the x-ray?
What I found when I got those records and looked at them in April, the pain that I felt and what shows up in those pictures, those concur. What the doctors were telling me and the pain that I felt, that didn't match up. And then what the doctors were telling me and what I was seeing in the pictures, that didn't match up either. I got those CT pictures back, and those pictures, they definitely show that my skull's broken. And that totally explained to me what pain I had.
Are you qualified to read an X-ray or a CT? Do you have a medical degree, or do you have some type of training that would teach you to read either one of those things?
No, sir.
Sir, I can tell you, I've been doing this for 18 years, and I can't read an X-ray or an MRI.
I don't think you have to be medically qualified to see a broken bone in a X-ray picture. But no, sir, I don't have those qualifications.
Okay. Do you have a medical professional that has looked at those pictures and said, yes, I see what you're speaking about, and I do see a break. I do see. You see what I'm looking for?
Yes, sir.
I'm looking for something to hang your hat on that says each one of these 11 physicians messed up in your care in some way.
This injury that I had, it did not heal. And it became worse and worse and worse, and it became infected over time. Now, what started to show up in these official diagnosis and pronouncements from these medical people was they began to note the side effects of this main injury, and I believe that the side effects, they noted infection. I had a nurse that noted this is in a record that I have noted possible parasites. So they began the emergency room in St. Vincent's. They noted in August 2019 when I went back for the second CT scan. They noted infection, mastoiditis, and leukocytosis. So what happened was, over time, the side effects began to be noticed. But I believe the main injury, a number of these doctors, they would not diagnose because of the severity and in the relationship to the EMTALA and the insurance and the ability for me to pay. That's what I think. So I got those pictures in April. Okay, I found that, and then I went back and I looked at my other pictures. And what I found, to my satisfaction, is I believe that this hospital and the doctors involved, they were involved in patient dumping. They patient dumped me, and I believe this is a EMTALA violation. It's United States federal law, EMTALA. And I don't know if you're familiar with this, but patient, you go into the emergency room. There's an obligation for them to treat you based on your injury. Now, what I believe happened in my case was, I went in there, they asked me about my ability to pay, they asked me about insurance, which I didn't have. I didn't have a job, I had no source of income. And I believe that what happened to me was that they used the misdiagnosis as the vehicle to circumvent telling me the truth about my